Today, we're diving into a really interesting medication for Parkinson's disease. It's called Entacapone. Now, it's not the main star of the show, but as you're about to see, it plays this absolutely critical supporting role. So let's get right into it.
Okay, so before we can really talk about Entacapone, we first have to talk about the primary treatment for Parkinson's, a drug called Levodopa. You see, it's the absolute cornerstone of therapy, but it comes with a pretty big challenge, creating what a lot of patients call a daily roller coaster.
And that brings us to the real heart of the issue we're tackling today. I mean, can you imagine how frustrating this is from a patient's point of view? You're taking the best, most effective medication out there, but your symptoms can just suddenly reappear between doses? So why on earth does that happen?
To get what's going on, you need to know two key terms that neurologists use all the time: on time and off time. On time is when things are good. That's when the levodopa is doing its job, and motor symptoms like tremors and stiffness are being managed well. But then there's off time, and that's when those benefits seem to vanish, and the symptoms come roaring back, long before it's time to take the next pill.
You know, this whole up and down thing actually has a name. It's called the wearing off effect, and it happens for a couple of big reasons. First, levodopa has a super short half-life, which just means your body chews through it really quickly. And second, as Parkinson's disease progresses, the brain itself gets less efficient at storing the dopamine that levodopa helps create. So the bottom line is, the drug's effect just doesn't last long enough to get you from one dose to the next.
And this right here is where our helper drug finally makes its appearance. Entacapone was designed to do one very specific thing: fix this wearing off problem. Not by replacing levodopa, but by helping it work better and longer.
Now, this is so important to understand. Entacapone does absolutely nothing for Parkinson's symptoms all by itself. Think of it like a sidekick. The technical term is adjunctive therapy, which basically means its entire job is to boost the performance of the hero drug, levodopa.
So how in the world does it do that? Well, the science is actually pretty cool. And to really get it, let's use a little analogy. Let's imagine we're trying to patch a leaky fuel line. Okay, here's how it works in 4 simple steps. Step 1, you've got this enzyme in your body called COMT, and it's basically the enemy here because it breaks down levodopa before it can even get to your brain. Step 2, Entacapone swoops in as the protector. It literally blocks that COMT enzyme from doing its job. Step 3 is the result. With COMT out of the picture, way more of the levodopa you take actually survives the journey and gets into the brain. And finally, step 4, the effect. Each dose of levodopa now works for a much longer time. Simple as that.
This is really the best way to think about it. If levodopa is the fuel your brain desperately needs, that COMT enzyme is like a leak in the fuel line, just wasting that precious fuel before it can get to the engine. Entacapone is the patch. It stops the leak and makes sure more fuel gets where it needs to go for a much smoother, longer ride.
All right, so that's the science. But let's bring it back to the real world. What does all this actually mean for someone who's living with Parkinson's every day? Well, the benefit is simple, but it is profound. It means more on time.
So when a doctor adds Entacapone to the plan, they're really trying to achieve 3 things. Number 1, increase that on time, which means more hours in the day with good control over symptoms. Number 2, and this is just as important, is to decrease the off time, to shrink those miserable periods when the symptoms come back. And number 3, sometimes it even allows a doctor to lower the total amount of levodopa a person needs each day just because it's being used so much more efficiently now.
Okay, but like any medication, right, Entacapone isn't a free lunch. It has potential side effects and some really important precautions. So let's get into the practical stuff the patients and their families absolutely need to know.
The standard dose is typically 200 milligrams, but here's the crucial part. The timing is everything. It has to be taken with every single dose of levodopa. It has to be there at the same time to protect it. It's a totally synchronized partnership.
When you look at the potential side effects, you can kind of put them into 2 buckets. You've got the more common ones like nausea or diarrhea, and then you have some more serious issues that are thankfully pretty rare. We're going to zoom in on a couple of these specifically. So the most common side effect people report is something called dyskinesias. These are those extra, involuntary, kind of fidgety movements. But here's the twist. This isn't usually a direct side effect of the Entacapone. It's actually a sign that the levodopa is now working so well that the dose is a bit too high. So the solution is pretty straightforward. The doctor often just reduces the levodopa dose a little.
Now this next one is something you've got to file away because it can be really alarming if you aren't expecting it. Entacapone can change the color of your urine to a sort of dark brownish or orange color. Let me be clear, this is completely harmless.
It's totally normal. It's just your body processing the drug. It is not a cause for panic.
And finally, a few really key warnings. It shouldn't be used by anyone with liver disease. It can have a dangerous interaction with a certain class of antidepressants called non-selective MAO inhibitors, and this is a big one. You should never stop taking it suddenly. And as always, talk to a doctor if you're pregnant or breastfeeding.
So let's pull all of this together. What is the ultimate role of Entacapone in managing Parkinson's? Well, it's all about creating a precision partnership.
So what's the big takeaway here? Entacapone isn't a replacement for anything. It's a fine-tuning agent. It's the thing that optimizes how your body uses levodopa, smoothing out all those peaks and valleys. And that gives patients what they want most: more consistent, more reliable control over their symptoms all day long.
And that really leaves us with a final thought, doesn't it? It's just fascinating how a drug that does literally nothing on its own can completely change the game for the main treatment. It's a perfect example of synergy in medicine, where adding 1 + 1 gets you a whole lot more than 2. Thanks for joining me for this explainer.